Thank you so much, Lori, Jamie, for putting everything together. Presentation so far, guys.
Oh, they've been great.
Congratulations. It's been
Wonderful.
amazing.
Good job.
Yeah, it's been a great day. So I'm going to try and share our PowerPoint, which I'm failing at. Jamie, can you walk me through that? Shouldn't I just be able to hit the share? Oh, you're muted.
You're muted, Jamie.
Sorry. Do that every time. What happens when you click on share content? Anything?
Let's see.
Is it loading?
Sorry, guys.
It might be delayed.
Looks like maybe it's loading.
Yeah, just give it a second. Sometimes it has to do its little circle thing, and like mine's really slow right now. I'm trying to share mine and it's the same thing.
Okay. It looks like it's moving but taking a moment, so thanks for everybody's patience.
Worst case scenario, I can pull it up on my end and you can just let me know to advance the slides for you, but we'll see. There it is.
You see it?
I see, yep, I see a beautiful great horned owl.
All right. Okay, so we are going to go and as everybody else was saying, please with questions, feel free to do the chat or however Jamie and Lori want to do that with raising your hand or just the chats. We'd love to talk about things in detail. So don't want to bore you. So if you have questions, please let us know. So we, within the last few years, started using laser therapy here at our facility, and we're just going to kind of tell you a little bit about it. So down to the basics, what is laser therapy? So it's a treatment that is widely used by veterinarians as well as obviously human medical doctors and medical practices in general. It's very similar to acupuncture and massage therapy. It's an alternative therapy is what they call it. It can be used in conjunction with or in place of medications to manage pain, inflammation, and wound healing. Here at our facility, we use it for a wide variety of things, and we'll get into that a little bit. And so there are several different kinds of lasers, probably way more than I would even know about. But what we deal with is the multi-level lasers for surgical lasers versus therapy lasers. So surgical lasers are going to penetrate the skin and almost heal as they cut, if you will. So with the surgical laser, it closes blood vessels as it cuts. So this becomes really beneficial in veterinary fields for spaying of dogs and situations like that, and healing as it cuts. We obviously use just the laser therapy, which is also referred to as LLLT. So it was widely used in Europe and Australia before it came to the United States, and it's recently been approved by the FDA, which has been great. One thing that we have seen help with in the veterinary field was sugar gliders, for example. You could do a sugar glider neuter in seconds with the surgical laser and then hit them real quick afterwards with the therapy laser and basically heal them up almost immediately from there. So when, let's see, how does it work and when should it be used? So our biggest points of it being used, we like to use it for arthritis. We use it for any kind of muscular pain, healing in the bones, skin and wound and abrasions, increasing for tissue regeneration, nerve regeneration, feather growth, and for feather plucking or picking.
Can I show it? Can I show it?
Yeah. Trying to do a laser together.
I don't know if you can see it. It's very small, easy to handle.
Yeah. So studies show that lasers and the treatment will help heal very quickly, a third to half of the time faster than your typical healing time. So if your bird has a broken wing, say, and you're able to use a laser on that situation, they say that it will heal quicker, much quicker than if you don't use it. So one of the things that we use it on, if you can see here, we have our great blue heron with fishing line. So we're all familiar with that, unfortunately. Very deep down to the bone. We were able to use our laser therapy on that bird and full recovery. The great horned owl stuck in netting, we see this all too often as well. That bird didn't have any physical injuries externally that we could see, but was very, very sore, obviously, from fighting, trying to get out of that. So we used laser therapy on that bird, and both birds actually were returned to the wild and released. So that was a very exciting time for us. So a little bit about what we did and how we came across laser therapy and why we use it here. I started using it and got introduced to it in the veterinary field for large and for small animals. So we were using it on horses and alpacas and cattle even, as well as your older arthritic Labrador or your kitty with urinary tract issues. So I had this broad scheme of what people could use it for. And I was working at a veterinarian, Dr. Linda Randall, who did a lot of work here at our facility with us. And we were fortunate enough to be able to use her laser, the hospital laser, and bring it here to the facility along with her guidance. One of the biggest things that we saw right away is we started to work with our older bald eagle, McGeezy, who's very arthritic. She had a nasty break in the leg when she was a baby. And so you could see just the benefits of this laser therapy in the bird and how much it helped her. We then started to really do a lot of treatments on our rehab birds while we had the laser here with us. And you could see this healing time on the Raptors of just, it was incredible. So we really took the time to say, you know, that's not an inexpensive situation, but we want to go ahead and move forward with it. So a lot of creative money, making ideas and grants, and we were able to purchase one. So my mom, Laura, and another volunteer who is a veterinary technician did a lot of studying on what would be good here. You have the really high-end lasers that, again, you can use on large animal, down to your cats. We needed something that was very easy for us to use, not too complicated, and handheld, and not a bunch of cords and wires everywhere, because you never know with the bird of prey what's going to happen. And so what we did is we did go with a smaller one. The company that we went with has been extremely helpful in helping us determine what is the best way to use this laser, how many minutes, what setting it should be on for what kind of situation. And so it's been great. Go right into what our laser looks like. Here is the laser in its package. It's a nice little package. So we went with the LZ30. At the time, which was a few years ago now, we did spend around $5,500 on that. But it's just been so very helpful.
Yeah. It's just been great.
It's a rechargeable, you can plug it in. It has a USB port. You'll see several different pairs of glasses, so anybody around you has glasses on when we're doing laser treatments. So you'll see, obviously, our beautiful volunteers getting the laser out and getting ready to work on it, as well as our gorgeous bald eagle McGeezy. I have to throw that in for Mom. If not, she gets upset with me. But and then you'll see the laser has a little screen on it. And so we have pre-settings on it to show us, the laser itself has hundreds, but we really coned it down to what works best for Medina Raptor Center or rehab in our facility and what we need it for. So one of the big ones we use is pain, and we can just use that setting. And then we know about how long we should be doing it, and run a little course on it. You can use it every single day. You can use it every other day. You can use it once if the bird is extremely hard to handle. once is better than nothing. So it's always a good idea to at least try. We use it for, as we talked a little bit before, with the skin abrasions, and if we have a bird that goes in for surgery and they have a broken wing and a pin in, you can use it for all of that. And so there are studies that say you can use it through the bandaging. Our veterinarian prefers that we take the bandage off most of the time. So we do on our rewrap days, we do our laser treatments at that time as well. Let's do. So this is when a bird, we put a hood on them, just so you know. We need to cover our eyes as well as the bird and anybody around. So we do use the falconer's hood for our rehab birds. If it's an owl, obviously the falconer's hood is not going to work. Or if it's one of our educational birds, we have to come up with different ways to do it. That's just not going to be conducive to try and ask one of our ed birds to put a hood on and, you know, scare them that way. So with an owl or a bird that we can't put a hood on, we do use a towel. We will use a piece of cardboard cut kind of out for the wing, if you will, to block that laser beam so they're not getting that any laser into their eyes. And so we work alongside with our veterinarian on all of it. We want to always go with their with our veterinarian's protocol first and foremost. Laser is very safe, but always ask before you use it. It's easy to laser our rehab birds, easier because they're handled daily, whether we're getting them out to clean their enclosure, do a bandage change, things like that. So it's an easier job when you're already doing treatments on them. So currently we're working with this red-tailed hawk, and he has been quite the challenge. He came in January with a broken coracoid clavicle, and there's definitely some nerve damage. And so he did start to self-mutilate as his nerves started to come back. And it's been quite a process with this bird to see as he's been picking and if we laser versus when we don't laser. So it's been, it's definitely a true color of what works and what doesn't for him, for this bird in particular. So this was a barred owl that we took in that was an attack by something. Your guess is as good as ours. Very nasty. This was kind of in the middle of treatments. We don't only use laser. We haven't done that yet. We're any cases where we haven't used anything else. We use it alongside of Medicam or anything that's been prescribed by the doctor. That laser has been wonderful, but any help that we can give the bird, we want to. So we don't only use the laser, but it's definitely a great asset to have with it. But this bird's nasty punctures. It was thought to be another owl, and fully recovered, grew the feathers back, and was released. This is another great horned owl that we do have in care currently. This was another situation of a bird being stuck in netting. And what we did with this bird, you can see the first picture on the left, the bird did start to self-mutilate to get out of the netting, is our assumption. And with that, it was nasty when he first came in, definitely down way too deep. And then there was a lot of abrasions on the back. Within a day, this is what this wound looked like with laser treatment only. So it's a pretty big difference and a really good example of how the skin does heal and can heal from that. So this is hopefully a success story. So this guy's moved out into a flight cage, and hopefully we're going to be able to release. So a couple of notes with our laser. You always want to protect anybody around with glasses. So if we're going to do a laser treatment, we alert all of our volunteers. Laser's going to be in process. We don't do it in a room where it's going to be widely, utilized, where people are going to be passing by. Anybody in the room with us, we are going to have them wear protective goggles. When we're lasering, we want to make sure, if you're like me and you talk a lot with your hands, that you're not lasering all over the place when you're doing it. So you want to just make sure that you have your laser where it's supposed to be. Where we do our laser treatments, we do have other birds in the back, so we're making sure that those cages are covered. Obviously, the picture of my dog, if she's ever around, she gets her glasses on. And so again, you want to make sure that people around you do know what you're doing. With the laser treatments, you always want to keep it moving, right? So you always move your laser back and forth, up and down. You never hold it onto one area for very long. That can burn, even though these are low lasers. These aren't penetrating skin lasers. They still will cause damage if you hold them on there too long. So you always just keep your laser moving up and down, up and down. We use it for physical therapy, moving a wing out and back and out and back. You're lasering the whole time everything is moving. We always ask our veterinarian, is this a good candidate? I don't think his answer has ever been anything but yes. However, they know better than we do, and we just always, a simple question can save a life. So always go with the consulting of your veterinarian. Laser therapy can take a while, so I wanted to throw this in there for our fellow rehabbers that take that breath, maybe use it as a little therapy for yourself to go ahead and relax a little bit while you're doing laser treatments on your birds or mammals. We really can't say enough about it.
Yeah,
and again, we'll be happy to talk with all the questions, but how in depth you wanted us to get as far as the birds that we've been using it on, but any of our ed birds, they're obviously here for a reason, right? They have some sort of disability one way or another, and so we can use it on them so often, and it's just been phenomenal. It's just been great. And so any questions? I saw the chat pop up a little bit, and I know we kind of zoomed through this, guys, so I'd love to talk about it, and just let us know what kind of questions you may have. Any experiences you want us to share, we're happy to do so.
Okay, so there were a couple of questions. Heather asked if you use this on barbed wire cases at all.
Oh yes, absolutely. Yeah, great question, Heather.
Yeah.
And it's so so beneficial because like that barred owl that you saw, it's really deep, and so the laser it's very beneficial on that.
Okay, and then Manon asked, have you used laser therapy with a bird that has problems with blood feathers? I have a peregrine that constantly picks at her blood feathers.
Yes, yes. Feathers are really, it works beautifully on that.
Yeah, we've done that. We have a snowy owl who has issues with blood feathers, and due to his original injury from coming in, and so we are able to do the therapy on that. Absolutely.
And then Gwen made a comment, said this would also be a wonderful topic at OWRA conference if you're willing to teach.
Sure.
And then Tim asked if there were any size limitations per small birds like songbirds.
No, and that's a great question, Tim. And I really kind of went more towards our raptors, but absolutely, you can use it on mammals. You can use it on songbirds. We do a lot on songbirds, little wing injuries, things like that. We're absolutely able to do it.
Yeah. Our veterinarian really, they're just crazy about this, and they really help us out.
It definitely sounds like a good thing then.
Yeah.
And Kristen asked if you'd used it on mammals, which I think you already answered, Missy.
Yeah, absolutely. And we have used it on humans as well. It is actually a human device. So that's how I keep our volunteers around. I say, if you've got aches and pains, come on in the office. We'll help you right up. So, but yes, absolutely on mammals as well. I can speak from experience in the veterinary field, using it on small mammals versus, again, large animal. There is no size comparison. It's perfect.
Okay, and then Heather asked if you could email her the information on how to acquire the machine.
Absolutely. Absolutely. I would be happy to do that. And ours, again, there's a lot out there. The one that we came up with was just the one that works best for us, and was
One of the cheaper.
yeah, somewhat affordable within our price range. So, and any local rehabilitators, if you need laser therapy within your, from a veterinarian that they've said that would help, please get a hold of us and reach out. We feel really fortunate that we were able to get our laser. So if we can help you in special cases, let us know.
Let's see here. Jennifer says, do you need any sort of vet license to do this work? Any regulations?
No, not for this particular kind. There are a couple veterinary specific lasers that have either higher output or any obviously surgical lasers you would need special classifications for, but this one that we have is not anything that you need to have any kind of licensing for. It's great to go through the company and get all the information, have them train you and teach you, so you know what you're doing to make sure you're benefiting and not hurting anything.
And ask your vet what he would recommend or she would recommend as far as, the settings and go from there.
And that may have answered Manon's question. She had another question. Is there certification program for using laser therapy?
There are a lot of programs out there that are super beneficial and have a lot of information, but you do not need one specifically for, at least we can speak for this laser, the one that we have. There's a companion laser, is a huge veterinary laser, and they have a lot of really great information and classes and CEs on theirs.
Great. And Deb just made the comment that she has a much smaller unit that she uses on herself and horses with great success.
Yay! Yay! That's right. Yeah, it's really, you can tell it does help, whether it's I do my mom's shoulder or I help a bird. It's definitely everybody has their own beliefs and medications versus alternative, and I really think we can speak from experience that it's very beneficial.
And Manon says they need you to come and teach us at OWRA.
You got it, no problem.
It's so wonderful to see an older bird. You put them back in the pen or the enclosure, and they are so much more comfortable. So it's worth it.
Yeah, you'll see some of the Ed birds, you can tell in the winter, they're hurting with arthritis like so many people are. And we give them some laser treatments consecutive, and their appetites increase back up and their normal behaviors. And so it's really, really amazing to see.
Yeah, and that's got to be a relief.
Yeah, it really is.
Oh, the questions keep coming in.
Go ahead, please.
Kristen says, is the red light a low level laser?
Yes, we use a low level laser here. So there's several different beams that come together into one, but it is a low level laser.
Then Annie, let's see. My thing just moved on me, sorry. Annie says to Deb, would you be willing to share what type of laser you have? So Deb, I'll let you answer that for Annie. And then how long does each treatment last?
So that's a great question.
Yeah.
It depends. So it absolutely depends on what we're dealing with. So if we're dealing with a skin abrasion, it can last anywhere from 45 seconds to we can go for 5 minutes. If we're dealing with arthritis, we could do 2 minutes to 8 minutes. You can go longer. You're not going to hurt anything, but there are specific studies that will show the benefits per, your time frames. Again, our laser has settings, which most of them do. So it focuses on if it is a skin abrasion versus muscular or skeleton. It'll let us know. It does have a time on there. But since we've been using it, we also kind of make up our own. So we know that this bird really benefited from 5 minutes, or this bird can only tolerate 1 minute. So something was better than nothing.
When I first got it, I was scared of it, and I used it very quickly. And then when Missy, having worked with it before at her job, when she started working with it, she used it much longer, and we saw much better results with the length. So, but you have to get used to it.
Sure. Tim says, how often do you need to do it again after each treatment?
So again, it's kind of per case. The bird that we have that we highlighted, the red tail with the broken clavicle, and that feather plucking, we do him every day. If we don't, you can tell the next day. You might see where he has tried to self-mutilate again. I always feel like one is better than nothing. So if you have a bird that some of our ed birds that don't come out of their enclosures often, and we have to come up with very creative ways to get their laser done, whether it be PVC pipe holding the laser and getting into their enclosure that way. Once is, again, it's better than nothing. So if we do one treatment for 2 to 5 minutes, but if we have the ability to do it every day, absolutely, that's most beneficial.
Okay. Well, awesome job, ladies. That was very knowledgeable.
A little bit short on that. I didn't know. Kind of rushed through it. I apologize.
Yeah, my dancing days are over. So
we can turn it over to you. You can do it.
No.
Oh, come on. No, it was great to have you ladies join us and present.
Thank you for having us. And please, guys, reach out to us if you have any questions on laser or do want, some help with your birds. We're really happy. Again, we feel blessed to be able to have the laser. So if we can help somebody else, let us know.
I think these ladies ended early for an ulterior motive. I heard that Heather Merritt does a heck of a tap dance routine.
That's right.
Oh, that's it. Yeah.
No, I do not. No, I do not.
Heather, I've heard that a couple of times now.
It's really what's going on the streets, Heather.
Well, I don't know. So Tim is our last speaker of the day. He's going to talk about banding of rehab birds and what they've learned at Lake Erie Nature and Science Center. Tim, if you're on here and you're ready, we can go ahead and move on to your presentation if you would like.
Does anyone want to take a break first, or we just want to go?
Let's just go if that's okay.
Yeah, it's cool with me.
Okay. Unless you want a break, but
oh, I don't. I just was making sure that no one else did. That's all.
We'll go ahead and go.
Okay. There we go.